Hello, Stockport. My name is Emma Vardy. I'm a consultant geriatrician at the Northern Care Alliance, and I've been working with Dementia United on the Delirium programme of work, including the Community Delirium Toolkit. And I wanted to say a huge thank you to all of the colleagues from Victoria Proactive Primary Care Network who were involved in the pilot in 2020.
Hello Stockport, my name is Helen Pratt. I'm a project manager with Dementia United, working alongside Emma Vardy on the programme of work for Delirium. It's been absolutely fabulous to be working with colleagues from Stockport who were, as Emma mentioned, involved in the pilot in 2020. A huge thank you to Jane Etches from the crisis response team, who has been really leading on the work after the pilot, as well as colleagues from district nurses, Sharon Plant. We've also had involvement, I believe, with the implementation of the toolkit with Pennine Care, Mental Health Liaison and Community Mental Health Services, as well as colleagues from Discharge to Assess and Active Recovery. So it's been brilliant, really, to hear about all the work that you've been doing over the last year in getting to this stage where I believe you're launching the rollout of the toolkit across the District Nursing Service, Crisis Response, the Mental Health Liaison, Community Mental Health, Discharge to Assess and Active Recovery. Wow, that's absolutely brilliant, Stockport. We really are so impressed that you've got to that stage. And I believe you're also linking into primary care practices and services. So I just wanted to really focus for your launch on how we've got to this stage, really, with the Community Delirium Toolkit. For those of you that may not be aware, we started work on this in 2018, actually. We held free World Delirium Awareness Day events. I think colleagues from Stockport may have been at the ones in 2018 or 2019. And from that, we were able to harness a real great community of practice with colleagues from primary care, allied health professionals, mental health services, doctors, acute hospital colleagues, and also we've had lived experience engagement right from the outset, all of whom came together and worked with us to develop the Community Delirium Toolkit, and we're also in support of it being tested and piloted in 2020. So it's great that we're at this stage after the pilot that was undertaken by Stockport and 4 other localities. I'm now going to hand you back to Emma.
So why is it important to be rolling out the toolkit? Well, many reasons, and I think it's one of those areas that once colleagues have started using it, they sort of realise so many benefits that they might not have anticipated. So it enables early detection of delirium, and that means that we can look for causes in a structured way and manage it well. It also means that through using a toolkit, we can address inequalities in delivery of assessments and care and use a standardised approach. Detecting delirium early means that patients have access to treatment early. It also enables delivery of safe care in the patient's own home and support for both patient and carers. And so what difference has the toolkit made? Well, we used the data that had been submitted from the pilot and collated that, and we put a publication together that was published in Future Healthcare Journal. And what we showed was that 70% of people stayed in their own home. Stockport was part of that pilot. And I think something that we are currently evaluating with the University of Manchester is those other added benefits, that raised awareness of delirium, the education around delirium, and raised awareness with both staff and also patients and carers.
Thank you very much, Emma. Emma's very kindly mentioned the pilot and some of the toolkit resources. Now, we have these available for anybody to download and access from the Dementia United website, and I'm sure that that will be shared with you as part of your launch and going live in June. It's important to let you know that we also have training resources which you're very welcome to access. We've collated those, and they're a range of resources from Delirium leaflet, a long leaflet, which has a person-centered care plan at the back, but there's also a shorter leaflet that's been translated into 10 languages. There's also an audio resource for that in those languages and a film. We also have a GP podcast where Emma Vardy was speaking to one of our GPs, Helen Martin, about the Delirium Toolkit and the rollout of that, and a very sort of useful 40-minute podcast about everything to do with delirium. As well as that, we have webinars that we've recorded, and you're welcome to download and have a listen for the North West Ambulance Service, and also ones that Emma and I have done about the toolkit itself and how we set up and what the toolkit contains. As well as that, there are resources that we've collated from other areas in England that you may find very valuable. For example, there's a really short, brilliant animation from our colleagues up in the north, and also there's a film and questions that you can do during that film, and you get a certificate at the end for support workers or family members about delirium. So lots of things to dip into, all on the Dementia United website, which you'll be able to access and download and use. So hopefully you'll be able to make the most of those. I just want to thank you again, Stockport, for being at this stage of going live in June 2020. You really are a locality that are trailblazing that implementation across so many services. We wish you all the best of luck with it, and we look forward to hearing how things are going once you're up and running with the toolkit. And you're welcome to make contact with myself and Emma if you really want any sort of further information. So many thanks.